So today we have a patient coming in with a classic ingrown nail. We can see that there's redness and a lot of thickening, and we're going to remove both of those sides. So once the patient is numb, we go ahead, we put a tourniquet on the toe. This tourniquet is only on during the procedure. We take it off after we're done. And it really helps with any type of bleeding during the procedure. It makes it a lot easier to do. Okay, so we've already cleaned off the toe really well. So the first thing we're gonna do is we're gonna loosen up the sides. We're using a freer elevator. And all we're doing is just kind of getting in between the nail and the skin and just loosening it up. So we've done one side. And you're just kind of going through until you feel the end of the resistance from the skin, and that tells you that you're completely lifted, and you can actually see some of that debris lift up when you're doing that. So once you've completed both sides, now you're essentially doing the same thing, but you're going underneath the nail. So you find that little pocket in the corner and you advance your freer, and you actually feel a little plunge, and that tells you that you're through the root. So now that corner is lifted. So now we come to the other side. And this one's got a little bit more resistance, but you feel it go through. So now you come in with a different tool. We call this an English anvil because that's what it looks like, or a nail splitter. And we take the flat side and we go underneath that same pocket we just created, and we crunch. Okay, so that's one side, and now the other. Good. So the nail's kind of brittle, so you can see a little corner of it popped off. All right. So now, again, different tool. We call this a hemostat. Come in, we clamp down, and you can see the size of that ingrown nail. There's one, and there's still some left in there. Look at that. There's the other part. Okay. And then you come back in and you make sure that there's nothing else left in there, which there isn't, nice and clean. So we come to the other side, clamp it down, and we twist, and that's the other side. So both sides of the nail are gone. You can see that once this heals up, it looks like a pretty normal nail as far as size and appearance. So that's it.